So week 3, this week we're doing school age and we're going to be doing adolescents. Now, these are the older kids. They think a little bit more, so they're a little bit more involved, and we'll go into that. You do have a CJ Sims due. Now, be careful. When you do the NCLEX questions, it is not under the normal pediatric section. It is under growth and development. And then you choose infants, toddlers, preschool, school age, adolescents, and then select your questions from there. It is on growth and development. Now, I will look at that. It is the best review before your exam to do it and make sure you do it properly. If I see that you gave me your PEDS, it's on time, and it's the wrong type, this is the only time that I'll say, okay, resubmit it by the next Sunday and I will not deduct any points. But try for that exam, doing those 50 questions are really going to help. All right. So that's why I'm bringing that up. That's and then as you do your NCLEX questions in the modules, it tells you, is it respiratory? Is it cerebral? Is it what? Making sure you're following it because there's rhyme and reason, how you do the questions, what the topics are, and then into the quizzes and to the exams, they sort of match up, all right? So any questions? So this week is all of the exam reviews. As I said, as I get them, I will be posting them in one announcement. I'll keep editing it. All right. So I'll say exam review recordings, and then I'll put some big something to denote, hey, I'm going to keep editing it. And then all of the professors' names. And as I get it, I'll put in the link, whatever, YouTube, Zoom, whatever it is. And I'll keep editing. So one place. If you notice, I put all the Kahoots. I put your study guide there. I put the dosage calc handout. It's all in an announcement. It says exam 1, study guides, Kahoots, dosage calc. That is one announcement. Go down all of those handouts. If you go through that and you go through the Kahoots and you test yourself and you know the answers, you understand the concepts, you will do very well on the exam. All right. The study guide, going through it. You can look at a previous study from me. There's slight changes, not like a big amount. So if you look at last terms, it's similar. You can start if you can only study like tomorrow for next week. I know your schedules are that busy, so you do have that option when it comes to me and my classes and all of my recordings there. So next week, come a little bit early if you can, so we can get you in, sign you up, and get the exam done, because we will have a class after the exam. All right. And I'm going to teach a class only on a Kahoots. And you're going to understand when I do it. They're just big concepts you have to know. And you'll get it once I do it. So let's go ahead and start. School age children. Now, when I did my dissertation for my PhD, my topic children, because I was one of these crazy people, one of only 2 in the whole university that did a pediatric dissertation. And I picked school age children. And I had to prove school age children were a great topic group. And what I found out with ages 6 to 12, which is what the ages of these are, it was a great group because of their honesty. They do not muffle the answer. They do answer questions honestly. Because remember, when we talk about Erickson and the way they deal with other people, they love to please people. So they're people pleasers. So school age children, large group, 6 to 12, lot of time. So they do start with looking like a baby And by the time they're 12, they're looking more like a grown up. They start with baby teeth, they all fall out, and it ends with all of their permanent teeth in. So it is 6 years. It is a lot of height, a lot of weight, but it's very slow, very steady. It's very slow like that. So the whole thing is 1 to 2 feet, but that's 6 years. So it's about 2 inches a year for school age children. Weight 2 to 3 kilos. Now, weight is going to double between age 6 to 12. So they're going through a lot of growth, but it's slow. So boys, girls, they're the same height, same weight, same look at this time. Now, we've got a preschooler who now has become a school age child. So again, they're getting longer, leaner, more agile. And this is what this is trying to tell you. There are no differences, head circumference, chest, and all that. No, we don't even look at those sort of stuff. We know that when we get to school age children, it's that age of all I want for Christmas is my two front teeth, right? And those pictures of no teeth in the front. And that should start about age 6. Now, do all children start losing their teeth at age 6? Christian didn't lose it till about 6 months ago, and he's 8.5 right now. So does it mean it just means a difference? They're all the same. Again, that's why I love kids. They're all different. You just have to know the progression where it should go next. Now, school age children, you can take them on trips better because their bladder, they can hold it more. Their heart doesn't look like it takes up the whole chest like an x-ray on a smaller child. It's getting smaller. They've had a lot of diseases, so they've got acquired immunities, plus how many immunizations. They're really building up and getting this good immune system now. Their bones are stronger, they're getting more ossified. And the one thing about school age children, as they get older, and I'm going to give you a great example because it's personal. I've got a 9-year-old grandson who looks like he's 15. He is shorter, maybe 5'2", but he's 145 pounds solid. And he looks older. Remember, just because they look older, mentally they're not. And this 9-year-old grandson, he needs to be treated as a 9-year-old. He needs to be treated his age. He doesn't understand more than that. So this is something in our nursing care plan to remember about. That's what physical maturity has nothing to do about how they pronounce herself into the world, even emotionally or socially too. Now, one thing about school age children, um, now they're getting to the point where things bother them. They take things internally. They don't like act out when they're stressed. What children do when they're school age children, all of a sudden you're going to see them. They used to be good at school. Now they're getting in trouble. They're forgetting to do their homework, or they're getting notes sent home. There's something that's not right. When they were a good kid, this is one that something stressful's gone on. And it could be as simple as they lost their dog, and it could be as involved as parents getting divorced, or my grandma died or whatever. So again, behavioral changes are telling you there's some sort of stress going on. Now, right at age 12, right at that puberty time, it's like 10 to 12, they call it. So puberty in girls starts about ages 10 to 12. Ever remember being in 5th and 6th grade and thinking boys were a little bit stupid and they were immature? Well, our hormones as girls are starting to go. Boys don't start till about 2 years later. And that's all of a sudden by high school, we all catch up. And that's where, of course, the hormones, and as Freud says, it's the genital stage, right? So prepubescence is an age where it's the beginning of puberty. Prepubescence, they also do a big growth spurt there at that time. Now, doing an assessment on a school age child, Well, it's going to depend on how old they are. Are they 6 or are they 12? A 6-year-old is going to be, I'm going to take a picture of your chest with a big camera. It's going to make a big click. It's not going to touch you. It's not going to hurt you, right? A 12-year-old, well, I'm going to take an x-ray. Let's see if your arm is broken, right? Different terms, different child. Remember assessments, you always look first. Kids, you can look at a child, well appearing or sick appearing. If a kid's hurting, in pain, doesn't feel well, you can look at them. The honesty of children and their feelings of how they feel, it's real, and they don't over exaggerate it. So that kid don't look good. I'm going to go now. I'm going to listen and I'm going to touch and I'm going to palpate, right? Seeing what's going on. Is it the abdomen? Is it, lungs going on? What's happening? Now, children, if their lymph nodes, you don't see them, they're healthy. So if you see a lymph node, that means there is some infection going on. So you should not really expect to see them on an everyday basis unless they're sick. Just like you did in foundations and you did your assessments, hypoglossal nerve on a child, you can have them stick their tongue out. I can actually get little babies. My little grandson, who just turned 3 months old, I can look at him go with a little tongue, and that little kid now is so as hypoglossal nerve works. So at all age kids, you can get them stick the tongue at you. Now, as you're listening to breath sounds, know that you can listen to the bronchus, right? Remember, there is upper airway. Kids are always full of mucus. They don't blow their nose. They're always noisy. Their lungs are not necessarily full of junk. It's that noise here. So again, remember, if we want to know the difference, you can put your stethoscope over, the upper airway, and you could hear that noise and then listen to the breath sounds on the lower lobes and say, it's referred sounds. Kids are hard to listen to breath sounds with because of they don't blow their nose as well as they should. All right, Freud. Freud in school age. Freud is anything sexual. What he says about school age children is that sexuality is friends. And he says children school age like same sex friends. That's what he talks about that. Erikson. Erikson is about how you deal with other people, right? Society, psychosocial, the way the people around them. So they like to be seen, right? So, sense of industry. Doesn't everybody like to do something well and to be recognized for it? I'm a great lasagna cook. I say I'm making lasagna and the world shows up. When I was in school, I was the best math. So I was known and I was praised. That's my sense of industry. Now, how do you remember this word industry? An industry is a factory. It's something you produce. It's your product, your industry, your product. That's what I do well. Makes me feel great. And it gives me approval from all my peers, right? Makes me feel I can do that better than you can, that independence. Now, can you do everything well? No. You've got children that are great at sports and they're bad at schoolwork, or they're great at schoolwork. They're no good at schoolwork and they're sport. I mean, either or. Somebody does something well, but they don't do it all well because they like to. That is that feeling of inferiority. So, sense of industry. That industry is, I feel good because my industry, my factory, my product, what I do well, I'm known for. But gee, I'd like to do all these other things, but I can't. So I don't feel as well as I should. I want to do it all. That is Erikson. Probably one of the most tested HESI NCLEX question. Erikson school age, that industry. Now, Piaget. Piaget is about thinking, right? Remember, we took that reflex grasp and then we realized we could do it ourselves. But we started out with that reflex, right? So it builds upon what they saw, what then building on it. They then grasped that rattle and then they moved it and it made a sound. That's the third step. And then, oops, it fell in the mouth. Oh, I like that in my mouth. So, what they learned. So, in school age children, their way of thinking, if they've seen it before, it's concrete. I can touch it and feel it and smell it. It's concrete. I've seen it. I can replicate it. Okay? That's they can't think by themselves yet. Abstract is when you think everything by yourself. That's adolescence. I'll go there next. Now, another thing about Piaget, he talks about liquids and items and having them in different shapes or more liquid, less liquid, but they're all the same. Um, at this age, children know that a tall glass of milk and you pour it into a short fat glass, that a child that was younger would take the tall glass thinking it was more milk, but it's the same amount. That's that master of conservation. And that's what this, straight out of the book, and what this tells you. Mixed up pennies or straightened up pennies, big bowl of clay or smashed clay, it's the same thing. All right. And I'm going to go formal next. All right. The other theorist that we talk about is called Kohlberg. Now, Kohlberg is all about morals. It's about right and wrong. Okay. Now, school age children, when they are young, they understand reward and punishment, right? That's your preschoolers, and that is going into the early school age children. After that, they just want to conform to rules so they don't get in trouble. They want to please everybody. School age children's morals, they're people pleasers. They want to be good. Spirituality. So, again, what does that in very concrete terms? Which means they've had to see it, touch it, smell it to understand what you're talking about. Do they understand a menorah? Do they understand a Christmas tree? Do they understand a what? That has been shown to them by the family around them. Because remember, family is your biggest influence on kids at all ages. So, children also believe that there's something. No, I don't think, even if there's not like as much spirituality in the house, but children believe if they do wrong, something, I mean, most people will call it a god of some sort, was going to punish them. So if I do wrong, I hit my brother yesterday and he bumped his knee and got a boo boo. And that's why I fell today and I broke my arm because I hurt my brother. I did something wrong, so I'm going to get punished for it. That's what they think. Peer groups, as I said, same sex peers, big thing. They're starting to learn other families and other cultures and other influences. They're into clubs and groups and activities, and other adults are over them. And one of the biggest things in families and parents and teaching families and parents is that still you have to be not their friend. You really got to still be there, listening, making sure that they're safe, asking them what they've done, where they've been, because you're giving up time to other people, other groups, other things. So making sure that they're safe. Still, that's the parents' responsibility. Play is big, any age. I mean, we all still play a game of some sort, right? I got a word game I love to play. So, do you ever stop? No. So, why do we play? What is the importance? Well, you've got to realize there's rules. You've got to realize there's rituals, that there's certain something you have to do. It's like going to job, getting your job done and following what you have to do. Isn't that what a game is? You have to put your stuff out, get your equipment, do what you have to do, win the game, right? Play the game and get there. It's great. Team play, how to work together, how to work alone, and then what makes you feel good. Is it playing the organ? Is it that you read a book last night, or whatever it is? We're all different. At this age, children are learning awareness of other people. Who is good at math? Who's the best runner? Who's a this, that, and the other thing? And again, they need to be told that what they do well, and they need to be praised and happiness. Very important. It comes to the point now, body image. They like what they wear. They can't wear just any colors together. They got to match for whatever reason. They're into hair color. Who's blonde hair? Who's that red hair? Who has freckles? Who has glasses? Who has a hearing aid? They're starting to learn and see these things. It doesn't make a difference to them, but they're seeing these differences. We know at 6, they're absolutely in school, starting to school, and know that what is school all about? Again, it's with other children, other adults, other cultures, other values, beliefs. Children are being exposed to all of this. Nutrition, nutrition, right? Is nutrition important during the school age years? And the answer is absolutely. At this age, these children are growing slow and steady, about that 2 inches a year, right? So they can't eat too much, but not enough. And they need to eat proper food because it's feeding the brain that's working, right? They're found that school age children are the best children to teach. There's old programs, Dare to Keep Your Kids Off Drugs, talking about don't smoke. This is one about learning how to use my plate and dietary and proper food groups. Teaching nutrition at this age is important. Now, school age children, overweight to the point of obesity, is becoming epidemic proportions. And what is all the reasons? Well, you know, when I was a kid, like a really long time ago, you got your school clothes off, you put on your play clothes, you got on your bike, and you went down the street. At a very young age, you didn't worry about people, you didn't worry about neighborhood. I mean, there was no cartoons then. That was only Saturday morning. So there was nothing for you to do but go out and play with your friends. Today, children go home. First thing, they're on their iPads, computers, your phones, and they're talking and playing games and Nintendo Switch, and their minds is all they're doing, and they're sitting. Now, yes, some of it's because of the neighborhoods, yes, but they have found that if we let our school age children get overweight, it leads to adults and adolescents even starting with overweight children that are at a higher risk for high blood pressure, diabetes, and high cholesterol. And it's all about that cardiometabolic, which means all of the calories that you're introducing in there and all the changes that it's done to the body. So if we can waytail that now as a school age child, they won't grow up to be, adolescents, or at least have the information, right? So early education is what we should do. One of the things that your book talks about is that obesity starts with pregnancy, with the baby. So it starts from a very early age and it goes all the way through. It doesn't care where you live, who you are, what culture, all of these things um, are they're all equally affected. So one of the things that I even see a lot is, you put the children down to eat for dinner or lunch, whatever, and the mother or father makes that child sit there until they eat all of their food. Well, what the research says is if they do that, they're putting in their mindset for life, they can't leave any food on their plate. What does that do? I'm full, I keep eating until it's empty. That leads to obesity. That's what that means. Sleep is not as much as a younger kid, right? Younger kids don't fight with bedtime, but we know your older school age children, they're not going to really say anything. It's ready to go to bed. They're going to go up, go to bed, do what they need to do. And it's not like, oh, can I have another kiss? I need to go to the bathroom. I need another hug. So, again, is it 6 years old or is it 12? Now, sports. Are sports good for kids? Well, there's controversy. Remember, you not only got other kids picking on the kids if they're not doing well, you've also got parents and brothers and sisters and aunts and uncles and grandmas and grandpas that are also in the sports arena rooting their child on. So it needs to have a parent aware of that, especially some children aren't as athletic as others, and those children might be made feel less than. So again, always be aware of it. We know children love competition. Absolutely, they want to win. They like competition, but remember, they don't always win. So parents need to be that for that. Dental health. Remember, they're losing all their baby teeth. They're getting all their permanent teeth in. So, making sure dental health is good. I mean, remember, losing teeth during this whole time, is it a sign of poor dental care? This one right here, it's absolutely not a sign of poor dental care. They're school age children. They're dropping teeth all the time, right? They're putting it under the pillow for the tooth fairy because they're replacing all of them. One of the things they say is flossing the teeth. The say that there is not enough manual dexterity for kids that are less than 2 years old. In second grade, I mean, they can't know how to floss it. So they do believe in flossing, and parents should help them for that. What would you do if your child fell down and their front teeth fell out completely with the root? What would you do? I've seen this, I can't tell you how many times. I've seen it with baby teeth, I've seen it with permanent teeth. Now, if it's a baby teeth, it's going to come out anyway, right? So it's not, some parents try to put it back in because what they do is they numb it. A dentist comes in, whether a pediatric dentist, you go to them, or you go to a ER that has a pediatric dentist, and they'll take that tooth, they'll numb the area with numbing cream, and they'll push it in. This is especially important if it's the permanent tooth. Can you imagine if the permanent tooth couldn't go back in and it's a front tooth? A lot of money, posts and things and crowns. And so again, dental avulsion takes and it pulls out the whole tooth. How do you transport that to this dentist? Very important. You put it in cold milk, not water, not a jar, not dry, cold milk. Sex education, they're getting inquisitive. Again, it's normal. And it's again, parents should sit with the child. They have questions. Let the child ask the question. One of the things, in nursing, you're going to have these children, especially school age children, and, they have these questions that are coming up. And sometimes they're going to ask the nurse. I mean, many of you or some of you might become a school nurse, and these children come in and ask it. Again, remember there's sex, there's sexuality, and then there's what you should tell the child. And again, what does a child understand? I think we assume that they understand more than they do. School health is great, great thing for things like pregnancy and older children, any counseling. When COVID came out, school nurses were like on top of it and had to work with the CDC to keep the children and everybody safe. So again, school nurse is actually a great job to have, especially if you have young children. So injuries. You'll always see questions regarding injury prevention, safety. These are always questions that will come up. You'll see it as again across all the exams that you have to come up with. You'll see these things. Now, injury in children, the most common cause, motor vehicles. Infant to adolescent, most common, motor vehicles. Remember, rear seat for all children till age 13. Booster seats till they're 8 years old. Now, ATVs. I live down in Homestead, Florida, which is by the Everglades. And west of Chrome Avenue is like all open fields, farmland, etc. And the kids down here love, and they all have these ATVs, and you see them out there all the time. They do not recommend these for children under 16. And I can't tell you how young I've seen kid out there, and it scares me. And the reason is they don't have the mental capacity if something happened, what to do. There's not telephone connection way out there. That's part of it, okay? And again, remember with anything with sports, always safety, safety, whether it's knee pads, helmet, all those things, very, very important. Remember, families and children, they started out at 6. They needed mom to help them get to the school in the morning. And at 12, you're throwing them out the door in the morning. Go ahead, catch the bus, go to school. It's a complete different change and shift in what families are. One of the big issues in children school age, they find children with ADHD. They can't sit still. The biggest thing is inattentive hyperactivity. It's evidenced by not being able to complete a thing. These children, usually at school, are a little disruptive because they can't sit. They're sent to the nurse's office multiple times usually, and this school nurse, she needs to call the parents and make a plan for this child. Many times parents have done everything, and it's just the school nurse to listen. Maybe they have one more idea to help these parents take care of this child. Bedwetting. Ever have a child that's older than 3 or 4 that occasionally would wet the bed? Well, there are older kids who never stop wetting the bed, and at night they just do. One of my nephews, I think, was 9 years old, and he still couldn't. Then all of a sudden he grew out of it, of course, but he did it all the time, so it wasn't abnormal. What happens if you're already, quote, potty trained and you start wetting the bed at night? It is telling you something is going on. It could be diabetes mellitus, diabetes insipidus, urinary tract infection. Again, bedwetting in itself, it can happen. Sometimes it could be psychosocial, but most kids will grow out if they always do it, and know that If it all of a sudden happens, there's a problem. The other thing kids like to do is hold their stool. Then we're going to go into that into GI a little bit more. But no, one of the things with holding their stool is there's always some liquid around the hardness that has impacted in the rectum, and it will come out and it will look sort of loose and diarrhea-y. And when you see these stains in their underwear, this is ecoparesis. Okay, so here we go. Let's see if you listened. A child with an avulsed or knocked out tooth, the parents are reluctant to try to implant the tooth. Where should the tooth be placed for transport to the dentist?
Milk.
In cold milk. Yes, ma'am. Thank you so much. All right. Adolescence. Do you all remember being an adolescent? I remember being a single parent of two adolescents, a boy and a girl, 17 months apart. And I remember holding on for my roller coaster ride. And my kids are both great kids. But you do. Adolescents, what do we know? They start as they're growing up from a child, school age, still young, mentally. Then they're growing up to be an adult, to grow out of the house, to get a career, to raise their family and go on with life, right? So this is a time of rapid physical, cognitive, social, and emotional maturation. Usually by the age of 18 or 20, your child is going to grow to their biggest height. My son, I think, was 22. I sent him to the Army at 19. He came home at 21. He'd grown 6 inches in those 2 years. I said, whoa, what happened? He went 5'7" and he went to 6'4". And it was right there at that age 20 when he grew. I was like, thank goodness the Army had to feed you. I don't think I could have fed you all the food you needed. So what do we see? So again, we start into adolescence. You're sort of the baby face. You're going into puberty. What's the first sign of puberty in girls? You get breast buds. What's the first sign of pubertal changes in boys? Is testicular enlargement, okay? One of the things about girls and boys and now these preventative things is by age 12, they should start those HPV series, okay? It's boys and girls. It's a 3-dose series. Now, I've seen HESIs when they're talking about the Tanner stage. So I brought it into the class and I posted it up here and I want to show you how to look at it. When we look at, there's two tables, boys and girls, all right? So stage 1, you're still a child. You're still not grown up. Stage 5, you're completely adult. So it's stage 2, 3, and 4 are the stages you'd have to choose from a question. What stage would you be in if you saw testicular enlargement? Well, let's look down. There it is. It's starting up. And we're going to be in stage 2. Thinning and scrotum coming up. Where's my breast bud? Stage 2. Now, if we see that it's this and this is going on, it might be stage 4. So the reason why I brought it here was for you to be aware of it, what it looks like, and how to read it easier, and how to make a better choice on which Tanner stage of development you would be in. So remember I told you at the beginning of adolescence, they grow 20 to 25% of their height. This is the biggest growth spurt since infants. Remember infant, it's the biggest growth that you'll ever see in any human at any moment of their life. This one's the second one. And it's about 2 to 3 years, but they grow 20 to 25% of their height and their weight. And that's all during puberty. So what do you think is going on here? They're eating like crazy, right? They are growing like crazy. Their body's changing body image is going like crazy. So let's talk about how they deal with other people and how they deal with themselves. And psychosocial. They need a sense of identity, which means, how do I fit in with everybody? Do I like girls? Do I like boys? Do I want to be a mathematician? Do I want to be a nurse? Do I don't want to be in the band? All of these things are my identity. Do I like short hair, long hair, curly hair? All of these are identity. The way I dress, the identity, inside, outside, my identity. This is what I need to have. And to have that, it's all about feeling good about my body image. Adolescents go through a lot of changes and pimples and growing and, baby fat and all of that stuff. And it's those body images is the big thing. So, adolescents, who am I? Who am I going to be? And my body, what does it look like? I want it to look better, right? One of the things with because of body image and having to like themselves, there's a lot of eating disorders. There's bulimia and there's anorexia nervosa. I've just got a couple of questions on the cahoots about that because we don't go into it deep. Just know that there's a vomiting problem with both of them. Now, that's one of the things you might see with body image. The other thing is, if a adolescent or says, my friend is telling me, your adolescent brother, sister, or your son, daughter, is telling you, they're saying about they want to hurt themselves. Well, take it seriously always. Sometimes they don't talk about it, but what it is if you start seeing changes again, remember those school age children, we start seeing behavioral changes, something's going on. It's probably stress there. Okay. Adolescents, you're going to start seeing them sleeping too much or sleeping not at all, irritable, eating too much, not enough, staying home or not staying at home, or talking about death and dying. Take all those things very, very seriously there. As I said, it's all about their identity. It's all about their peers. It's all about the groups, the way that they're, hanging out with their buddies, right? And it's their body image. This is all about an adolescent. And it is intense sociability, intense loneliness. There's so much heartaches as being an adolescent. I would never want to be an adolescent again. It's your best friend, what ended up called your boyfriend, and they're going out on Saturday and you figured it out. So you've lost your best friend, you've lost your boyfriend, and now you're lonely and upset and angry. This is adolescence. This is that stuff that goes on there. Again, as a nurse, just be aware these things are important to these children. The other thing is, now they're getting up. They've grown up. They've pre-adolescent growth spurt. Now they're about 15 to 17 years old. These children now think that they're grown up. Their voices are now deep and low, the men, right? And hair on the chinny chin chin. And you're not going to tell me what to do. Well, struggle. Children, parents, that's a constant fight. This is where I say roller coaster ride. Hold on, hold tight, don't give it up. What would a nurse tell a parent that's going through this? Well, if you can, get them to sit down together and make up a compromise. How can we compromise here, right? I mean, adolescents, they're headstrong. They think they know it all. They don't. And then it's like, hey, mom, I need $40. I need to go to the movies. And you're like, huh? We just had this argument and now you what? I know. This is part of adolescence and growing up and that figuring out. And of course, it's parents' fault all the time. Don't worry, in the 20s, they come back to you and they love you again. But boy, adolescents are pretty rough. Relationships with peers is number one, right? This gives them that sense of belonging, feeling really good. Best friends How they treat a best friend is how they're going to treat their partner for life. They are good with their best friends and thoughtful and caring, it's going to go on through life. Now, how do you talk to an adolescent? This is a hard part of being a nurse. I worked in an emergency room, so I was having rapid patients in and out. I liked the rapid area. I liked seeing those kids and talking all the time. I didn't have to always be in the trauma, although if they needed me, I'd run. But adolescents are very difficult. Now, I'm an older woman, I'm threatening, I'm like a mom or a dad. How am I going to get an adolescent to talk to me? Who am I? I'm just another nurse, right? I'm one of those authority figures. So, as a child comes in, I'll always pick a clue. Do they have a New York Yankees baseball hat on? I'm say, huh? You're a New Yorker. Me too. I don't like Boston. What about you? I've caught their ear. Or they're listening to music. And I say, oh, who is that you're listening to? It sounds familiar. And they're going, la, la, la. I said, I actually saw that in concert. It was amazing. Or I have tickets. Or if you really do real life experiences, or they've got the best like Nike sneakers on, right? And you're like, oh, where'd you find them? My kid really needs them. So there's such things you can do to break open an ice. And then you want to get really close, have the parents walk out of the room, close the door, and now you can have a conversation. That adolescent is more willing to talk to you because you are now less threatening. And I will tell them, I don't have to tell your mother what you're telling me. I'm here to try to help you so you can feel better. So, what do you want to say? And most of them will open up and talk, even if it's things about sexuality, multiple urinary tract infections coming in and out. I've seen them here before, and finding out it's because they're sexually active and the mother doesn't know it. Giving them a thing. Well, one of the things, if you urinate right after sex, it can help decrease the incidence of urinary tract infections. Now, I've got to able to teach her that where I might not have before. So again, it takes a little time, but in the long run, you've helped a child, adolescent, at least be more responsible for themselves, right? And again, if they can't talk to mom, I'm not going to always be there in the ER listening. They always have a school nurse. And going to that school nurse, most of them are really open to talking. As I said, immunization's all about that HPV, that 3-shot series. Again, nutrition is important, that big growth spurt. Most adolescents, again, I'm too fat, they don't want to eat. It's a bottle of water, power bar, walk out the door, and nutritionally, they don't get everything they do need, right? So if they're having these weight fluctuations, how do you determine if there's a problem? Anything with nutrition, any age child, what's the first thing you should find out? Give me, what did you eat today? Tell me, what did you eat yesterday? Give me a 24-hour diary. That's always going to be your answer. Problem, nutrition, what do you need? What is a child eating? You start with that. If you don't know what they're eating, how can you change it, right? 24-hour diary. They should sleep. Adolescents are on the phone till 4 in the morning, sleep till 6, wake up and go back to school. And it's just what they do. They shouldn't, but they do. It's adolescent. They are with their friends, they're studying for exams, all of that. Sexuality, well, I think adolescents could teach some of us adults some things today, but a lot of it, looking back, and it's funny because I'm going to tell you how old I am, really. There was a show, Lucille Ball, and I love Lucy. And way back in the beginning of the 60s, they had a show where they showed the bedroom with 2 single beds. And that was, oh my God, scandalous. They don't believe they did that. Look at all of the sexuality on TV today. You see them in bed on regular mainstream TV. Way back, yes, it is a long time ago, I know, but that's how much is out there available. So, where would you get information, sexuality, and for your children? Well, parents, if you can. I couldn't talk to my parents. There was no way. I wasn't going to tell my mother anything. But of course, I knew where you needed to go. School nurses, if they're available. And of course, there's Planned Parenthood. And the one thing about adolescents, and if they're in your care, and you've got permission to take care of them, you can give them without parental consent, without information on birth control, if they need that, if they're asking for it, written and oral information, not your opinion, just information that they need. You can without parents. A teenager, again, safety, what I said, motor vehicle, always number one. And then, of course, firearms, because they think they can touch a gun now and they know how to handle it because they're now adolescents. Sports injuries, because they're trying to be the best to get all those scholarships, right? And we really do need to prevent those injuries, etc. So, question, Matt is age 14. So he's at the beginning of adolescence. That's that pre-adolescent growth spurt, 20 to 25% of the height and weight there. He seems to be always eating, although his weight is appropriate for his height. What's the best explanation for this? What do you think? He needs to feed the tank. He needs to feed the tank because he's gaining weight. It's part of his growth and it's absolutely normal. Absolutely normal. So, any questions? Great group of kids. I still, every time I teach adolescents, I relive my children and what I went through, and it's quite amazing. So, all right, you ready for a Kahoot? Who wants to win? I need a winner. Xavier, Krista, Jasmine's gonna. I know you are. Brianna, you like to win. Okay.
Is it time for break?
So we could take a break or we could get out early. It's up to you.
I would like to go home.
Is that okay, Aaron? Okay. I want to keep everybody happy. Doesn't matter to me. I'm here. All right, let's go for it. School age adolescent children. How does the onset of pubertal growth spurt compare in girls and boys? So in girls, it's earlier than boys, and I always remember it because I remember at that age, boys just they seemed silly. They seemed sort of dumb when they were younger, and all of a sudden they were more mature. They grew up or caught up or something. A multi. What activities are appropriate for a 6-year-old child? So think about their cognitive development and think what they can handle. Very good. That really is surprised. It's probably the first class you didn't pick competitive sports. And you're absolutely right. It's too early yet. But a hopscotch, riding a bike, jumping a rope, absolutely, that's all a 6-year-old does. Okay. They're agile on their legs, they can move, they can jump, hop on one foot. But competitive sports, mentally, they're not quite ready yet. At what age should a parent expect to have major conflicts over independence and control with their child? That's about 15 to 17. Yep, sure is. It's a hard time of their life. Signs of the onset of puberty in girls. So, what's the first thing you see on that Tanner's stage there? It's the development of breast buds. Very good. And remember, it goes breasts and then gets taller and then hair comes. It's all part of it. The onset of puberty in boys is characterized by so boys is testicular enlargement, girls is nipple buds. What do we use to determine if a female has reached the age of menarche? So you're looking at a female and you're looking at her with an assessment. How would you know they've reached the age of menarche? And it's Tanner stages. And what are we doing? We're looking at breast sides and pubic hairs and all of that, yes, but we are determining are they've reached it all complete? Tanner stage will say what they had to have in order to be there. A child goes to the ER, they have a low fever, a pruritic or itchy rash, and open oozy papules. What's your nursing care? Well, what do you think that means? Itchy rash and open oozy papules, fever. What do you think? I worked in the ER for 10 years, and I would get a child coming in with symptoms, and I had to know what to do to protect them and to protect me and everybody else in the ER. This child, when you see rashes and papules and a little bit of a fever, think chickenpox. This could be varicella. And one of the things I always heard repeatedly was various stage of healing of the papules in there. Again, it's airborne. So you think it's all wearing gloves and a derrick? No, it is airborne. Put on an N95 mask, and that child should go into a room which we call a negative pressure room, which means the air in that room goes through a filter outside, does not get returned in the hospital, and give chickenpox, varicella to somebody else. The source of injury, whether intentional or unintentional in adolescence, is associated with what? What did I tell you? Injuries. So injuries, motor vehicle, always be number one, always, in any age child, whether they're in it, rolled over on it, or driving it. A 9-year-old friend tells him soccer's a dumb game and he should play baseball. Remember, school age children, friends, what are they all about? They're all about same sex peers, right? Friends. This is what they want. So I don't like soccer is telling this kid, well, either I got to play baseball or he's got to play soccer, right? Because it's all about everybody wants to be accepted. Everybody wants to feel good about themselves. And that's all about psychosocial, the way working with the environment, peer acceptance. Big deal at this age. During admission, the father of a 16-year-old says, we're Buddhist. Culturally competent care includes what? So the thing about culturally competent care, and I want to tell you a story with me. I was this white Anglo-Saxon Protestant from New York. I didn't know culture where I was born and raised. I moved by myself to Miami. I dated an Armenian. I was involved with Iranians during the hostage crisis. I was with a Cuban. I have a Cuban husband. I'm with a Jamaican. I'm all over the place with cultural. How do I know what culture is? And for my patients and even myself, I ask. And the one thing about people in culture, when you ask them, they are more give you more accolades because you really are concerned. So, is there anything I need to know about taking care of your child that, I wouldn't understand? And they will answer it. Also, remember, a 16-year-old is old enough to tell you about culturally competent care too. So you can ask parents, you can ask the child. When teaching sex education and contraceptive for adolescents, what should the nurse consider? So, with teaching about sex, contraceptives, adolescents, remember you can always kick parents out of the room. Or if you're a school nurse and they're asking you questions, you can give them information. Again, written and oral information, not what your opinion is. A multi-select. The management of adolescent obesity should include. No, with adolescent obesity, number one, as I said, always get a diary, see what they're eating. So we know how to, make food choices and exchange this for that. Always try to put some of their favorite foods in there. That you can't just eat all the stuff they don't like. One of the things you say, yeah, using a reward. Now, using nutritious food as a reward. Here's a carrot. You did really good. Have it. Now, no, but maybe on Sunday you've been so great you can have a scoop of ice cream, or sherbet. not a nutritious reward, just a, normal. Okay. So again, adolescent obesity, again, get them really involved. And it starts out with that 24-hour diary. Which action would improve dental health in the school age child? So, one of the things about dental health, remember, they're getting all their baby teeth out. They're getting their permanent teeth in, and taking care of them from early age is important. They're going to be there for life, hopefully, right? So, again, encouraging the child to floss when they can. And remember, child less than first grade, they don't have the dexterity to be able to do that. An 8-year-old girl says that she has cancer because God is punishing her for being bad. Why is that girl saying that? God is punishing her. What's that all about? So again, remember, at this age, children believe if they've done something bad and they get hurt, God is punishing them. They hit their brother yesterday, but today they fell down and broke their wrist because I was bad. They expect it. So again, super common belief. I would always understand this with children when they come in, let's say breaking an arm, and say, listen, you did nothing wrong. I said, these things happen. It was accident. So what color cast do you want? Change the mind, change the attitude. Give a color of a cast to a child, especially a girl. I'll get you a pink cast. Oh, they're really happy. A 6-year-old needs to get a chest x-ray. What explanation is the best? So remember I talked about school age children, age of children, and explanations. So again, technician's going to use a camera to take a picture to look inside. I mean, a 6-year-old boy, you tell them they're going to go for an x-ray. They think gamma radiation rays are going to come out and zap them like superheroes, right? So this child's not going to want to go in that room for that x-ray. So again, explaining what they're going to get simplistically, you save a lot of problems. And what I started doing, we were lucky enough to have um, computers in every room. I could pull up the x-ray. I would show all the kids the broken arm or the constipation or the pneumonia or what I could see on an x-ray. And it helps them understand to help make themselves better. How do you get an adolescent to be more receptive to talking about their health and sexual exploration? Again, adolescents, I know most of you, can you talk in front of your mother freely about things like that? Probably not. It's probably not a good idea. But if you need to understand that to take proper care of them, have the parents leave the room. And then, of course, open up that, communication by the things that I've talked to you about, making that adolescent feel less threatened by you. A child has a knocked out tooth. Where should the tooth be placed for transport? It's going to be placed in cold milk. I've been asked why. I think cold, so it's not going to be warm like grow bacteria. I think it's milk because it's calcium. And I think calcium enamel, I don't know, but there's really, but it works. Put it in cold milk and it does save the root, and especially permanent teeth. They can push it back in there and then they save a tooth and a lot of dentist problems. A nurse planning care for a school age child should know what thought process is seen. So remember, with school age children, they are all about concrete thinking, right? Abstract is the adolescents. They can fight their way out of paper bags to get what they want. School age children is about what they've seen. This ability can serve why they use that word, I don't know, but that's about the tall glass and the short glass. It's fat. It's the same liquid in each one. It's conserve. It's the same thing. It's just the weird words they use on that one. What stage of Erickson would you use for a school age child? What did I tell you about school age children? I'll warn you, there's 5 or 6 questions easy on theorists on this exam coming up. So I'll warn you. So trust versus mistrust is an infant trusting or not, okay? Autonomy versus shame and doubt is automatically mine, me, I do toddler. Initiative versus guilt is a preschooler. And industry, my factory, my product, what I do well, over I can't do everything well, inferiority, school age children. School age children's moral development. So remember, morality in Kohlberg and younger children's all about reward and punishment. When they get to school age children, they don't want reward and punishment. They just want to conform. They want to please. They're people pleaser. They don't want that right or wrong. They just want to do good. A multi-select. Anorexia nervosa is characterized by. Okay, there's 2 sorts of eating disorders that we discuss. Anorexia nervosa, and the other one is bulimia. Anorexia nervosa. Anorexia means nothing in the mouth, nothing. They barely want to drink water. They are over exercise like crazy. And even when they are 40 pounds and dying, they still think they're overweight. It's an unrealistic body image, fear of gaining weight, and severe calorie restriction. Now, the difference between anorexia nervosa and bulimia is bulimia, it's still worried about the weight, but they tend to eat everything like crazy and then vomit it, vomit it, vomit it, vomit it. Now, they both can be very skinny. They don't give the chance of the food to digest. But what happens is, what's in your stomach? Stomach acid. When you vomit, what happens? It rots your teeth. So the difference you would see between anorexia nervosa and bulimia is rotten teeth is bulimia. Okay? What behaviors would you see with a child with bulimia? See, all of the other ones here are going to be the anorexia nervosa. Well, that's exercising, not eating food, using laxatives, diuretics. They do all of those things. Bulimia, they eat, and vomit, 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 vomit. What is an adolescent's heart rate? I think actually what an infant was, right? Was an adolescent. And the point here is you really do need to know different heart rates. If you see something that's low or high, you can say, is it pain? Is it dehydration? Is it what's going on here, right? So an adolescent is slightly lower than an adult, 55 to 90, because they're younger. That's the only reason. When we go up to over 100, 105, 120, that's tachycardic for an adolescent. That's tachycardic for a normal adult. When talking with an adolescent regarding personal health concerns, which is most important? So the thing about adolescents, they are going to, if you get them open and they're going to be talking to you, the thing about adolescents, they like to talk and they like to say things that are going to shock you. One of the things I've learned is a poker face when talking with them. I've been told things that I'm like, what? But you can't do that. And the most important thing is to give them the time they need to talk, to express their feelings. That's what this is all about. Give them the time and listen. Don't preach, listen. A parent says the infant puts everything in their mouth. Based on Freud's theory, you would respond how? I'll always give you some of last week's information just to keep you alert. Again, Freud is all about infants, all about oral, exploring the world by their mouths. Very good. A multi. What could be a sign of potential child abuse? One of the big things in potential child abuse, and if you're wondering, there's an absolute inconsistency between the injury and what they tell you how it happened. It doesn't really make sense. A lot of times, if you can get the child and the parent separated, the stories can be different. Sometimes the child is so afraid they won't even talk. They're afraid of the parents that bad. So again, as a nurse, what is your job with a child that you feel is abused? Protect the child. And you would do that as an RN. You report it to your charge nurse or to the doctor, and they would be calling in whatever they needed to do to protect the child. In school age conflict of industry versus inferiority, what does industry mean? So school age, industry, factory, product, what I do well. What do I do well? I mastered that task. I make a good lasagna. I play a good piano. I'm really good at spelling. I mastered that task. What clinical finding does not indicate an adolescent may be suffering from anorexia nervosa? So, what's different between anorexia nervosa and bulimia, right? They're not anorexia nervosa. And again, that's that vomiting from bulimia. That's the stomach acid that you see their teeth rot. And it really, you'll see them rot when it's prolonged vomiting that they've been doing. Cooperative play, another one from last week. Remember, there's three sort of plays you absolutely have to know. You have to know parallel play, associative play, cooperative play. And it's a progression of play. Parallel, toddlers, always toddlers, next to each other, not sharing. Associative play, oh, they're all playing together, two or more kids, but they're not making anything. There's no goal. And then cooperative play, it's like playing checkers. Somebody wins, or they built the house, or they built the racetrack. Cooperative play. Those are preschoolers, school age. What does moral development involve? I apologize. Moral development, again, toddlers don't really understand it quite yet. Infants absolutely don't understand it. When they get into preschoolers, reward and punishment. And as they get up into school age, it's going to be pleasing. All right. That's the difference of moral development. Developmental milestones are important to observe because why do I need to know that child can sit unsupported at 8 months old? It's not 6 months, it's 8 months. What if they can't lift their head up and they're 7 months old? Why do I need to know that? Because they're giving you clues. Something's not right. And then what do we need to do? Well, of course, report it, and the physician is going to order some early intervention. Which of the following immunizations is given in the adolescent stage? And it's the HPV 3-shot series. Okay. Boys and girls, we give it to. ADHD most likely involves which of the following? So, activity, right? Overzealous, attention deficit hyperactivity disorder, up around all over the place. I can't finish a thing. It's like you got ants in the pants. That's the old saying that your mama used to say. What do you have, ants in the pants? Sit still. Typical child, they just can't focus. It is that inattention, distraction, impulsivity, and hyperactivity. These children have a hard time focusing. Some can do with just some sort of care. Some need medications. They're all different levels of what we do for these children. Oh, multi. An adolescent's been brought to the ER with a drug overdose. What are the initial questions you should ask? So, initial assessment. You got a child, I guess you can talk to them because you can ask. What would you ask this adolescent? What's going to help you take care of this child in the ER with a drug overdose? So getting to the point of rehab, I mean, that's like so far down the distance. We need to know right now, acutely, what did you take, when did you take it, and how did you take it? And how did you take it? It's going to tell me how quickly it's going to be out of the body, right? If you've done IV, it's going to go out quick, but orally lasts longer, right? So again, length of time, what it is. And then if we need to do reversals, we know what we can use. A 9-year-old recently has stomach pains in schools. Also, the child's been aggressive and stubborn. Why do you think this is going on? What did I tell you about this child? He's getting stomach aches and he's getting stubborn, aggressive. What's going on? And this is absolutely a sign of stress. Sometimes children don't know they can talk to somebody and help them, and they don't think they can. And so they take it out by just being this aggressive and stubborn and not feeling well and taking it internally. So, again, it's signs of stress. Recognizing it and getting them help is what they need. And last question. A nurse teaches a safety course to school age children about their community. What should she include? Safety course for school age children. What some big things? This is community safety course. Okay, school age children should know, like, really beyond fear of strangers. Safety, maybe, but absolutely. A lot of these kids have to come home and they have to make their own snack, the good old macaroni and cheese, right? In the microwave. So learning how to use that's good. Water safety, important. If there's a pool around, they need to know they can't go in there alone. And of course, um, car restraints. If you mentioned before what I said to you, they should be back in the rear seat till they're 11 years old, and they should be in a booster till they're 8, just to keep them safety. These are things a nurse would talk about in these sort of courses. You got a KG. Whoop whoop. We have a Velna. Whoop whoop. You guys are something. Number one. Miracle. Good job. And a Cole and an X. Okay. Anyway, remember, these Kahoots are there for you to go back, look at things, see if you understand the concepts that are around them, practice them. Know that tomorrow I'm going to be doing my exam review. I'm going to be doing it 2 o'clock. Yes, it's going to be posted shortly thereafter. And again, one announcement's going to have all of the reviews there as I get them. So as I get reviews, that's where to look. You have your study guide PowerPoint, you've got the Kahoots to look at, and you have the dosage calc handout. Anybody who needs more help than that, get a hold of me, and I would love to meet with you 1-to-1 or 6-to-1. It don't matter. Let me know, and I'm here to help you. Okay. Anything from anybody.